Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast podcast today. My name is Terry Fletcher. Refreshed and happy to be back from Napa. It was a very fun trip, but back to work and liking the weather down here back in Southern California. We had a lot of rain up in the San Francisco area, so it was nice to come back to the 70s weather, and it's warming up here in Southern California. We're looking at 80s coming up here. So first day of spring last week was awesome, and here we go. First, welcome to our new sponsor, Brand Now, for supplement health. Zinc 50 milligram immune support promotes healthy skin, 100 tablets. So welcome as a new sponsor. Okay, so what am I going to talk about today on Top 10 Tuesday? And, I really want to talk about the medical coder and their vital role in quality patient care. I know sometimes people don't look at coders that way, and practices just look at them as, part of the billing office. But in the fast-paced, detail-driven world of healthcare, doctors, nurses, administrative staff, we all work tirelessly to provide the best possible care. And behind every successful treatment and every claim filed, there is a less visible but equally critical aspect that impacts patient outcomes and the financial health of medical practices, and that's medical coding. You think about it, medical coding provides a standardized language that ensures all healthcare providers involved in a patient's care are on the same page. So when codes are accurately reflective of what happened within that encounter, a patient's condition and the treatment provided, this can foster a seamless communication flow between primary care physicians, specialists, and any additional providers involved in a treatment plan. So, for instance, suppose a patient undergoes surgery and subsequently, let's say requires follow-up care. Accurate coding of the initial procedure enables the follow-up care providers to clearly understand the patient's history without needing to review complex records from the beginning or from scratch. And the continuity of care leads to better patient outcomes, reducing the chances of miscommunication or oversight. So here is my top 10 of a more detailed explanation of why medical coding is so important. And remember, medical coding, and I'm going to put billers in this space as well, it really is key, and there's a direct link to patient care and positive outcomes. So number one, accurate reimbursement. Medical coding is crucial for healthcare providers to receive proper payment for the service they provide. I know if I talked money first, you'd hear me. Accurate coding ensures that claims are processed correctly and that providers are reimbursed appropriately. Streamlined billing processes. This is number two. Standardized coding systems help to streamline the billing process, making it more efficient and less prone to errors. Number three, reduced risk of errors and fraud. Accurate medical coding reduces the risk of errors and potential fraud, which can lead to financial penalties, legal issues, and auditors like myself coming in and saying, what the heck are you doing? So it definitely helps reduce those risks if you have competent, certified, and I don't want to just say certified, but you want to have coders that know what they're doing, experience, let's say that as well. Number four, maintained integrity of medical records. So accurate coding ensures the integrity of medical records, which is essential for patient care and treatment planning. What about facilitated communication? Medical coding facilitates communication between healthcare providers, allowing them to share information and collaborate more effectively. Remember, those conversations aren't always being had, and so medical coding is what we use to really bridge that gap between what's going on and what is actually happening in that patient encounter. So, those are a few things that are really important from a financial health of the patient and what you need to do to understand that, medical coders not only are important, but also are as vital and as essential to your practice as your back office staff, as your clinical staff, and, as your providers, because you can't you can't have one without the other. We obviously, as a coder, as an auditor and educator, I can't be successful unless I have my providers. Well, providers would be stuck if they were the only ones that were involved in the entire process. They need people who basically, I don't like to say stay in your lane, but basically are in the space that can now extrapolate what that information is from the documentation, from if you're still using charge masters or fee tickets, or whatever that encounter capture is, and then making sure that coding is accurate, not just from CPT, which is procedural, not just from ICD-10, which are the diagnoses, but remember, coding also is about linking codes, about knowing coverages and plans and policies, and also making sure that's not just for billers. It's making sure that you know that this CPT code, procedural, whether it be an E&M or a procedure, is going to be linked to this diagnosis code, ICD-10-CM, that even you might have a HCPCS code, which now you're getting into drugs and medicines and, certain supports for patients, certain tangible items. And so coding is important, and you never should discount that or the coders. And so one of the things that I think is tough is when you're negotiating contracts, always include a coder. If you're negotiating a payer contract, first have a meeting with your coders. If you only have one, sit down with your coder, or if you have multiple, and ask them, what are the things that you're noticing? I would include a biller too, on when you're coding, or when you're getting denials, or when you're trying to figure out how to, navigate great payment for me. What are the things that you're seeing? Sometimes I only see either the provider and the administrator involved in these discussions, and they forget about the coder. Who do you think is actually getting, your payment from whatever you negotiated in that contract without any input? And so I just wanted to kind of dedicate this episode to coders, and just making sure that the providers are understanding that the role of the medical coder is just so vital in quality patient care. And I don't think that's said enough. Now, I know most of you heard that telehealth was extended through September 30th, 2025, through the last continuing resolution from Congress. There's a couple of nuances there. I do have a telehealth. Actually, you might miss it. There's one tomorrow, which is the 26th. You can still sign up for it at the nschbc.org. And I have one on Monday, the 31st, with McVeigh Seminars. And you can go to McVeigh Seminars, MCVEY Seminars.com. So I have 2 telehealth coming up. Today, I actually have 2 Medicare first quarter, webinars. So that's for everything. And we touch on telehealth, but it's not the focus. But if you're interested in finding out more and getting, the information, in writing, feel free to take a look at those 2 telehealth webinars that are coming up again tomorrow, the 26th, and Monday, the 31st of March. So everyone, just, have a great rest of your week. I hope you had a really good March. Hope you're excited that we're in springtime now, and make it a great day. And thank you for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1, or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.